Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering priority. Lots of students have problems with priority questions, delegation, what patients to see first, what can I give the LPN to do versus the CNA, versus what do I as an RN have to do, what kind of patients do I have to keep. So this video is going to be on prioritization. Please, as always, do not forget to like and subscribe below. Always, guys, if there's some content or video that you'd like to see me do, make sure you leave in the comment section and I'll make a video for you. So let's get started. A 17-year-old is admitted with irritable bowel syndrome and shingles. The charge nurse is making assignments for the 3 to 11 shift. Which of the following RN should not be assigned to this patient? 1, an RN with a history of roseola. 2, an RN with no history of roseola. 3, an RN with a history of chickenpox. Or 4, an RN with no history of chickenpox. And I'll give you a moment to think of your answer. If I'm going too fast, guys, go ahead and just press the pause button, look at the question, think about it, and just press play when you're ready. So the correct answer is D, an RN with no history of chickenpox. Here's why that nurse cannot take care of that patient. If the nurse has never had chickenpox before, they're going to be susceptible, right? But anyone who's had chickenpox already, you're not going to get it a second time. Let me explain to you what shingles is. And usually the patients that have shingles, usually it's the elderly geriatric population, but young people can get it as well. So shingles is really the varicella zoster, that chicken-pox, okay? So that virus remains dormant in your body for years or even decades, and then something happens, it triggers it, and now all of a sudden it's been reactivated, and the format's not the way I'm looking for. The manifestation is now in shingles, okay? So any patient who has not had chickenpox before, any nurse, who has not had chickenpox before, you're not going to let them care for a patient with shingles because they will be susceptible. You have to choose a nurse that has already gotten the chickenpox, okay? So let's look at our other choices. A and B, there's no risk, okay? C, the RN with a history of chickenpox, they can see that patient because they're already immune. They got the chickenpox before. So that's why D is the correct answer. Any patient who's never had chickenpox before, you are not, I keep saying patient, you guys know what I mean, any nurse who's never had the chickenpox before, you are not going to allow them to care for somebody who has the shingles, okay? Next question. A 15-year-old male is admitted to the general pediatric floor with a diagnosis to rule out tuberculosis. Which room assignment by the charge nurse would be best? A, private room only. B, private room and place on protective isolation. C, room with a 15-year-old male with respiratory infection. Or D, room with a 17-year-old male being worked up for developmental delays. And I'll give you a moment to think of your answer. So the correct answer, guys, is A, private room only. Why? Because we're suspecting tuberculosis. Okay, that patient's going to be in a private room. They're going to be on airborne precautions. Remember, we put patients on airborne precautions when those particles are less than 5 millimeters. So if those particles are less than 5 millimeters, they're going to be on airborne precautions, because what happens is those particles stay suspended in the air for a period of time. So if I have tuberculosis and I cough or I sneeze and I walk away, somebody else comes walking right behind me. Guess what? Those particles were floating in the air. They breathe it in, and now they have it. So that's why if you even suspect a patient has TB, they're going to go in isolation and they're going to be on airborne precautions, okay? Let's look at our other choices. You have B, a private room. Okay, that's good so far, right? But these test writers like to trick us. They'll give you a correct answer and follow it up with something wrong. So it says a private room, great, and place them on protective isolation. No. Absolutely not. Let me explain something to you. The reason why we put that patient on airborne precautions, we're protecting ourselves. Us, the nurse, the patient, the staff, everybody else. We're protecting ourselves from the patient, not the other way around. You see where it says protective isolation? That means you're protecting the patient from everybody else. That would be somebody who has leukemia or some kind of disorder where they have decreased immunity. Okay, so that's why 2 is wrong. C, a room with a 15-year-old with a respiratory infection. C and D, let me tell you why both of those are wrong. The respiratory infection and let me go one by one. The one with the respiratory infection, you never put a patient that has an infection in a room with someone else unless they have the same type of infection. Other than that, if a patient has an infection, they need to stay in a room by themselves. We're not trying to infect anyone else. And then you have D, a 17-year-old being worked up for developmental delays. No, because this patient has a TB infection, or at least we suspect they do. So we're going to put them in a private room and they're going to be on airborne precautions. We never, ever, ever give anyone we even suspect with with TB, we never put them we never room them with anyone. The RN is busy assessing a post-op patient that just returned to the floor. Which of the following tasks would be appropriate for the charge nurse to assign to an LPN? A, assessing a patient that was just admitted to the floor. B, administering morphine IV push to a 2-day post-op patient. C, bolus feeding a patient that has a gastrostomy tube. D, reinserting an NG tube that a patient accidentally pulled out. Okay, guys, and the correct answer is C, feeding a patient that has a gastrostomy tube. Why? Remember, we give LPNs, we give new grads, we give RNs that are floating to our floor the most stable patient. Always. Always. Okay? And so in this situation, your most stable patient is C, the patient that had a feeding tube that you just have to give a bolus to. Let's look at our other choices. You have A, assessing a patient that was just admitted to the floor. First of all, assessing. In-depth assessment, who does that? Is the RN, right? And the patient was just admitted to the floor. Patients who are new, who has to take care of that patient? The RN. I don't care if you had that patient, they left your floor to go for whatever reason, a diagnostic test, they had to get an MRI, they had to get a CT scan, and then they come back, you treat them as a new patient because you don't know what happened when they got that diagnostic test. What if that patient went and got a CT scan, they were allergic to shellfish and now they're having a reaction? You're not going to know that unless you do an assessment. So if a patient leaves your floor and comes back, you treat them like a new patient, which only the RN is going to see. So anyway, A is wrong because of the assessment and they're new. RN has to see that patient. B, administering morphine IV. Okay, that's fine. LPNs can give IV. What did it say? IV push. LPNs can't do pushes. Never. LPNs can do IVs, but they can't do pushes. They can't do central lines. The list goes on. That's a different video. But anyway, B's wrong because it said IV push. RN has to take care of that one. And the last one is D, reinserting an NG tube that accidentally pulled out. They try to trick you with this one. So let me explain it to you. The LPN can do NG tubes. They can insert NG tubes. Absolutely. Here's the problem. The patient had an NG tube and accidentally pulled it out. So what do you think you're going to have to do before that NG tube goes in? In-depth assessment. They accidentally pulled it out. You got to make sure they didn't aspirate. You got to make sure they're breathing properly. So RN needs to see that patient. The most stable patient on this list is C. If C was not there, if that tube feeding was not there, D would have been your answer. Okay? But in these 4 choices, the most stable patient is C, and you're always going to give the LPN, the RN that is floating to your floor, and the new grad. It's an RN, but they just graduated, or an RN student. Always the most stable patient. Next question. Which task by the RN should be performed first? A, suctioning the tracheostomy. 2, changing a colostomy bag that's leaking. 3, performing an admission assessment on a patient that's been on the floor for 45 minutes. Or D, administering pain medications to a patient that returned from a surgical procedure 8 hours ago. And the correct answer is A, suctioning the tracheostomy, ABC, airway. We're always going to run to that patient that their physiological integrity is at risk. Remember, physiological, that's anything that keeps that patient alive. Oxygen, nutrition, vital signs, glucose, all that good stuff. So we're going to go to that patient first because suctioning that tracheostomy, if you have to suction a tracheostomy, that means that patient's not getting enough oxygen. There might be a mucus plug, but you're going to go to that patient first and make sure that that patient can breathe. Everybody else can wait. Okay, that's your priority patient. Before I move on to my next question, guys, how cute is this mug? I don't remember which class this was, but I'm a big coffee drinker, huge coffee drinker. And so they got me the cutest coffee mug. Great nursing instructors, hard to find and impossible to forget. I want to say this was my 1803 cohort. If it was, thank you guys. I love it. I'm still drinking my coffee. All right. Anyway, moving on. Next question. While a nurse was in shift report, 4 of her patients called the nurse's station. Which patient should the nurse see first? A, an 8-year-old whose colostomy bag is leaking. B, a 2-day post-op patient requesting pain medication. C, a 2-year-old admitted with failure to thrive whose mother requested formula. Or D, a patient who needs a peak blood level drawn because the antibiotic just finished infusing. And I'll give you a moment to think of your answer. And the correct answer is D, a patient who needs a peak blood level drawn because the antibiotic just finished infusing. Here's why it's important for that nurse to go, okay? When you're getting that peak, you have to do it in a timely fashion because if you miss your time to get that peak and you get it later, you're really not going to get an accurate level of how much of that medication is actually flowing in that patient's blood. So when the doctor looks at that number, they're going to, that's not a word, to misprescribe, but they may underprescribe or overprescribe because of the results. The results weren't accurate. You have a time frame after that med is given for you to go get your peak, to get your trough. So after that medication is given, if you have to do a peak and trough, as soon as it's done, go get it to make sure that those numbers haven't already decreased and the doctor is getting the wrong results because the doctor is depending on those results to write the next order for antibiotics. So it's really your job. You're really the eyes and ears of the physician when it comes to that peak and trough because they're really depending on those levels to decide what the dosage is going to be next for that patient. So that's why you're going to go see that patient first. The other patients can wait. There are no life-threatening situations going on. Which of the following would be appropriate for the nurse to assign to an LPN? A, changing a colostomy bag. B, hanging a new bag of TPN. C, drawing a peak antibiotic blood level from a central line. Or D, administering IV pain medication to a 2-day post-op patient. And the correct answer is A, changing a colostomy bag. Why? In this situation, the patient with the colostomy bag is the most stable. All that LPN is doing is just changing the bag. B, hanging a new bag of TPN. C, drawing peak antibiotic blood level from a central line. Now, you guys know LPNs do not do central lines. By the way, same thing for your B or TPN. And then you have D, administering IV pain medication to a 2-day post-op patient. So between, and LPNs can give IV medication, doesn't say IV push. So as a student, you should have been between A and D, right? But when you look at A and D, this patient obviously is in pain. That's why they're getting the medication. They're 2 days post-op. And A, changing of the colostomy bag, that's the most stable patient. You're going to give A to the LPN. And remember, the most stable patient you're going to give not only to the LPN, you're going to give it to a new graduate RN. You're going to give it to a floating RN. So you have an RN that is floating to your floor, but you work on a med-surg floor and they worked in labor and delivery, you're going to give them the most stable patient, okay? And the only time you don't give a floating RN the most stable patient is when you happen to have a patient that matches the background of the floating nurse. So for example, you have a patient with a gunshot wound and they just had surgery, and you have an RN floating to your floor, but they're floating from OR, or they're floating from ER, okay? Next question. A patient should be seen by the emergency, which patient should be seen by the emergency department first? A, a 6-year-old with a femur fracture. B, a 2-year-old with a fever of 102 degrees. C, a 3-year-old with wheezes in the right lower lobe. D, a 2-year-old whose gastrostomy tube came out. And the correct answer, C, okay? The wheezing, airway. If that patient can't breathe, what's going to happen? They're going to die. Remember, whenever you get a question asking you who you're going to go to first, you have to say to yourself, who can die first? Who has the possibility of dying first? You have to think about physiologic integrity. And one of those things that I talked about in my prior videos for priority. And guys, I have a couple videos for priority, and guess what? I'm going to be making a couple more because so many test questions are based on priority. And if you understand priority, guys, you may not know the disease process. You may not know that medication, but because you understood priority, you'll still get the answer right. Priority and delegation is weaved into so many questions on NCLEX, on HESI, on ATI, on your quizzes, on your midterm, on your final. Guys, I'm telling you, study priority and delegation. Study it, study it, study it, understand it. I'm telling you, you're going to see that you're answering so many more questions correctly once you get a hang of it, okay? So anyway, that patient that's wheezing, that's who you're going to see first, okay? Because they have the highest risk of dying if they can't breathe. And remember, not only are they wheezing, this is a small child. They have tiny little lungs. Okay, their body cannot compensate as much as the body of an adult. So that means they're going to go down and they're going to crash on you much quicker than an adult will. So you're going to run to that patient with airway obstruction, because the reason the patient's having that wheezing sound is the sound of air trying to get through, but it can't. Okay, that's the sound of narrow airways when you hear the breathing, when you hear the wheezing. All right. Which room assignment by the charge nurse would be appropriate for a 9-year-old child with ADHD? A, rooming with a 10-year-old child with Crohn's disease. B, rooming with an 8-year-old with a history of seizures. C, rooming with a 6-year-old admitted with clean asthma. Or D, rooming with a 7-year-old with a urinary tract infection. And the correct answer is D, rooming with a 7-year-old with a urinary tract infection. So, guys, I want you to think about this. This kid's got ADHD, and they're asking us, who are you going to room them with? Do you notice that A, B, and C all have something in common? A, B, and C. Patient with Crohn's, patient with seizures, patient with asthma. Those three need a quiet environment because those disease processes, emotional disturbances, triggers. What do I mean by that? So we have A, that patient with Crohn's, right? If they have an emotional disturbance, they get very upset, something causes them to be very upset, That's the trigger for what? For them to have diarrhea. Before you know it, now they're running to the bathroom. Why? Because that kid's got ADHD and they're all over the place, right? And now they get upset. Now that triggered their Crohn's. Now they're running to the bathroom, right? Then you have seizures. Patients with seizures need what? A quiet environment, because too much stimulation can cause what? A seizure. This kid's got ADHD. They're all over the place. You think they're going to be quiet? You think they're going to provide a quiet, calm environment for the patient with seizures? Absolutely not. And then you have asthma. You guys know that emotional distress is a seizure. Guys, I can't talk today. You know me already. You see my other videos. Anyway, it's a trigger, right? Patient has asthma and that ADHD kid is all over the place or says something that the patient doesn't like. The patient gets mad. And what happens? They have an asthma attack, right? So these type of patients, you want them to be in a quiet, calm environment, because we know emotional distress is a trigger for their disease, right? So we're not going to put the ADHD patient with 1, 2, or 3. D, rooming with a urinary tract infection. And I know what you're thinking, guys. I know you're saying, well, Professor D, you just said if a patient has infection, you can't put them in a room with anyone else. But if they have an infection that's infectious, what do I mean? Yes, this patient has a UTI, but is it infectious? Can you give a UTI to somebody else? No. So that's why you can put the ADHD patient with the patient with the UTI, okay? Yes, they have a urinary tract infection, but they are not infectious, okay? That's the difference. All right, next question. How am I already at 21 minutes? Okay, anyway, a teenager diagnosed with anorexia nervosa weighing 70 pounds is being admitted for behavioral modification. What room assignment by the charge nurse is most appropriate? A, private room. B, rooming with a 15-year-old diagnosed with Crohn's disease. C, rooming with a 16-year-old admitted with pneumonia 5 days ago. Or D, rooming with a 14-year-old diagnosed who had an appendectomy 2 days ago. All right, guys. The correct answer is A. Let me tell you something. When you look in the question, the minute you saw behavior modification, you know off rip. If it says behavior modification, that patient has to be in the room by themselves. I want you to think about it. If we want to change a patient's behavior, they're in for behavior modification. We have to change the way that they think and change the way that they react to situation or to stimuli in their environment, right? So they need to be in the private room. That's not the time that they're going to be in a room with somebody else that's influencing that or possibly influencing them or having certain conversations. No, you see behavior modification, that patient is going to be in a room alone. We are not sharing any rooms. They can't even have, when they're on behavior modification, they can't even have visitors, much less a roommate. Okay? Next question. The charge nurse is observing a student nurse that's caring for a 4-month-old infant in isolation diagnosed with RSV. RSV stands for respiratory syncytial virus. Which of the following would indicate to the charge nurse that the student nurse needs further instruction on isolation standards? A, donning sterile gloves each time she goes into the room. B, wearing a clean mask each time she goes into the room. C, labeling the door so staff will use airborne precautions. Or D, wearing a gown when she goes into the room to administer a medication. All right, guys, so the correct answer is A. B, C, and D are right. She's doing everything right. A is the one that's wrong. You don't have to put sterile gloves to go into a patient's room. Clean gloves is enough, okay? So isolation precautions, clean gloves is enough just to go into the patient room. So that's what she's doing wrong. Let's look at our other choices. B, wearing a clean mask each time she goes into the room. Absolutely. Wonderful. Why? The patient's on airborne precautions. Remember, guys, airborne precautions is the precautions where those patient's particles that come out of their mouth, come out of their nose. It floats in the air for a long time, okay? Those particles are 5 millimeters or less, all right? So yes, putting on clean mask, absolutely. That patient's on airborne. C, labeling the door. Yes, that's wonderful because everybody needs to know that patient's on airborne. So before they go into the room, they do what? Put on that mask, right? D, wearing a gown when she goes in the room to administer a medication. And that's why it's right, okay? If she was going into the room just to grab something, she wouldn't have. Okay, but she's going to be giving that patient medication, which means she's going to be doing what? Getting close, getting all up in the patient's area, right? So what if when she's giving that medication, that patient coughs, that patient sneezes, the patient starts to aspirate and they vomit, right? So you want to wear a gown because there are chances that that can happen. Okay, next question. A nurse is caring for her patients when the charge nurse notifies the nurse that her new admit just arrived on the floor. What action by the nurse is most appropriate? A, ask the nurse assistant to complete emptying the catheter bag and go assess the new admission. B, ask the nurse assistant to take vital signs on the new admit and begin history until she can get there. C, ask the graduate nurse on the floor to initiate the assessment process until she can get there. D, ask the unit secretary to make the patient and family comfortable until she can complete her present task. And I'll give you a moment to think of your answer. The correct answer is C, okay? She's caring for a patient. She's going to finish up what she's doing for her patient, but she's going to tell that new grad, the RN, go ahead and start the admission. Go ahead and because remember, start the assessment. Assessment is anything that gathers information, so she can start asking questions, right? That is part of the assessment, and she's an RN, she has a license, so you're gonna send the RN and you finish doing what you're doing for your patient, and then you go. Let's look at the rest of our choices so you guys can understand why they're wrong. A, ask the nursing assistant, so we're talking about CNA here, we're talking about an unlicensed assistive personnel, asking the nursing assistant to complete emptying the catheter bag. Okay, that's good so far. CNAs can empty bags, that's fine. But it goes on to say, and go assess the new admission. Excuse me? Can CNAs assess? Absolutely not. So we get rid of that. Then we have B, ask the nursing assistant, that's the CNA, to take vital signs. That's fine. CNAs can take vital signs on a new admit. And begin history. Excuse me, getting a history. Isn't that an assessment? Yes, it is. Can CNAs do assessment? No, they can't. So you know that's not the answer. Okay, remember, new patients require in-depth assessment that only the RN can do, not even an LPN, so you know you're not going to give that to a CNA. Choice D, asking the unit secretary to make the patient and family comfortable until she can complete her present task. No. You have a graduate nurse right there. She has a license. She's an RN. She can go to that room and start the assessment process, start asking history, start getting information while you wrap up what you're doing for your patient. Okay. Which of the following behaviors by a new nurse would alert the charge nurse that this nurse is following standard precautions? A, wearing clean gloves when performing a heel stick on an infant. B, not changing gloves in between assessment of patients in the same room. C, wearing sterile gloves when changing the urine bag and NG canister of an infected patient. D, donning a gown when responding to a request by family members to check the IV pump on a patient with rotavirus. So the correct answer is A, wearing clean gloves when performing a heel stick on an infant. That is the only correct thing in all of these choices, okay? Remember, you're going to wear gloves whenever you expect to come in contact with anything wet. Saliva, urine, vomit, feces, blood. I don't care. If it's wet, you're going to put on gloves. So number one's correct. Let's look at our other choices. Number one, A is correct. Let's look at our other choices. B, not changing gloves between assessment patients in the same room. That is wrong, wrong, wrong. I don't care if they're in the same room. You're going to care for that one patient. Take those gloves off, wash your hands, and then put on a new pair of gloves. C, wearing sterile gloves when changing the urine bag. No. When you're changing the urine bag and the NG canister, you're just going to wear clean gloves. You don't need to wear sterile gloves. And then you have D, putting on a gown when you have to go in a patient's room that has rotavirus and all you're doing is checking the IV pump. No, you only put a gown on when you expect to come in close contact with that patient, that patient may vomit or sneeze on you or cough, okay? But if you're just going to check the machine, there's no reason to put the gown on. Next question. The charge nurse is supervising a new nurse on the floor that just passed her board exams 4 weeks ago. The new nurse has a 4-year-old that is receiving blood. The new nurse hung the blood approximately an hour and a half ago. When making patient rounds, the charge nurse observes that this child has flushed cheeks. What is the most appropriate response by the charge nurse? A, inform the physician. B, discontinue the blood infusion. C, notify the nurse of the findings. D, ask the nursing assistant to take vital signs. And I'll give you a moment to think of your answer. The correct answer is B, stop infusion. Okay? Those, excuse me, those flushed cheeks, right? That's a symptom that the patient's having a blood reaction. Whenever a patient's getting infusion, it could be blood, it could be anything. If they're getting an infusion of anything and you see a reaction, the first thing you're going to do is stop it. Anything that's what's the word I'm looking for? Oh, come to me. But you're going to stop the infusion, okay? That is the first thing that you're going to do. After you stop the infusion, you assess your patient, then you call the doctor. Because after you stop the infusion, you're going to have to tell the doctor what's going on with the patient. You're not going to know what's going on with the patient unless you do what? Assess them. Okay? Offending, that's the word I was looking. So if a patient's getting an infusion, okay, anything that offends that patient, you stop that infusion immediately before you do anything else. Let's look at our other choices. A, inform the physician. That's the first thing you're going to do. So while that blood is running, it's infusing, you see that patient having a reaction, you're going to allow that blood to keep infusing while you're on the phone with the doctor. Hey, doc, yeah, I see the cheeks flushing. I think the patient's having a reaction, but yeah, the blood is still infusing. Does that make any sense? No, you're going to stop the infusion. Whatever is offending that patient, you stop it first before you do anything else. Choice 3, notify the nurse of the findings. That's wonderful. So this patient's getting blood. They're having a reaction. You're seeing flushed skin, and you're going to allow that infusion to keep going while you call the nurse. Oh, hey, I see something going on with your patient. You may want to check your patient. Meanwhile, your patient's dying because you didn't stop the infusion. That's not the answer. Then you have D, ask the nursing. Stop it right now. Let me tell you something, and I told you guys this, I think it was in my last video. Whenever something's wrong with your patient, the last thing you're going to do is tell the CNA to go check anything. You go check that patient. Or if something's going on with your patient and the CNA or anybody says to you, hey, I noticed whatever is going on with your patient, you never send anybody else to go to that patient. You check that patient. That patient is your responsibility. So we know D is wrong. So B is the correct answer. You're going to stop what is offending that patient. You're going to stop the infusion right away. After you stop the infusion, you're going to assess your patient. You're going to take vitals. You're going to get information on the patient. Call the doctor immediately for new orders. In that order. Here's the thing, guys. When you're taking NCLEX, when you're taking your HESI, and I don't care if it's a HESI comprehensive final or if it's a HESI, you know, just for that class, or you're taking ATI, you only have that amount of questions, the questions they give you, to let them know that you're a safe nurse, okay? So when you're testing, everything is a big deal. Never say to yourself, oh, well, that's not too big of a deal. You only have one chance to show that you are a safe nurse. Okay? Okay, I'm way over time, guys, so this is going to be my last question for this video, but I definitely will be making more videos on priority, so there'll be more to come. Last question. It would be most appropriate for the charge nurse to assign an LPN to which of the following patients? A 6-month-old with bacteremia. B, an 8-year-old admitted with DKA, that's diabetic ketoacidosis. C, a 12-year-old with Crohn's receiving TPN. Or D, a 6-year-old admitted to have a sleep study. And the correct answer, guys, is a 6-year-old. They're just there to have a sleep study, so they're the most stable patient, okay? A, B, and C are all unstable. A's got bacteremia. B is going through DKA. C has Crohn, and they're getting TPN. I think I'm going to cheat. You know, guys, I'm over my time, but we have a couple more. We're going to keep going. The charge nurse is supervising an RN that is in orientation. Which of the following would indicate to the charge nurse that the RN needs more instruction on administering blood? A, when the RN used a bag of normal saline to prime the tubing. B, when the RN notified the physician that the child had a fever of 101. C, when the RN got the nursing assistant to check vital signs after the first 15 minutes of infusion. Or D, when the RN got a second nurse to check the blood order and blood order product prior to hanging the blood. Okay, guys, so the correct answer is C, when the RN got the nursing assistant check vitals after the first 15 minutes of infusion. Guys, when a patient's getting blood, most often if they have a reaction, it's going to be within the first 30 minutes of receiving that blood that they're going to have a reaction. So you are not going to send a CNA to go to get the vitals. You're going to go get the vitals, because while you're taking those vitals, that gives you a chance to assess your patient and make sure that they're not having a reaction, okay? Let's look at our other choices. A, when the RN used a bag of normal saline to prime the tubing. That's absolutely correct. B, when the nurse notified the doctor that the child had a fever. That's absolutely correct. And D, when the RN got a second nurse to check the blood order product prior to hanging the blood. That is absolutely the right thing to do. So C is the correct answer because C was wrong. The nurse, the RN, should have gone in and taken the vital signs on the patient. She should not have delegated that to the CNA. And guys, this is where your critical thinking comes in. Because as a student, you're supposed to say to yourself, well, I know CNAs are allowed to do vital signs. However, I know that when a patient gets blood, within 30 minutes, that's when the patient's at highest risk for getting a reaction. So the RN needs to be going in there and taking those vitals and checking on that patient. A RN approaches the charge nurse after she makes initial assessment rounds on her patients this morning. The RN tells the charge nurse her load is too heavy and that she needs to reassign at least one of her patients to another nurse. What is the best response for the charge nurse? A, I can take one of your patients. B, notify the nursing supervisor of the dispute. C, ask the RN why she thinks her assignment's too heavy. Or D, explain to the RN that this is not possible because all nurses have the same number of patients. And I'll give you a moment to think of your answer. And the correct answer is C. ADPI, guys, the first thing you do is assess. Get information. I keep telling you this. Assessment's not only looking at your patient, doing a physical examination, asking questions, going in the patient's chart. Anything that gives you information is a form of assessment. So the first thing you want to do is find out why the nurse feels like her load is too heavy. Okay? Once you find out why she feels it's too heavy, then you can come with a plan of action. But you can't do anything until you actually know what's going on, and you're not going to be able to do that unless you ask questions. What situation would alert the charge nurse that an RN transferred to the pediatric unit needs an in-service on blood administration? A, the blood infused for 5 hours. B, a filter was used when administering the blood. C, the nurse got a second nurse to check the blood compatibility and product. D, the nurse got a set of vital signs 5 minutes after blood infusion was started. The correct answer is A. B, C, and D are all right. A is wrong. The blood infused for 5 hours. You guys know you don't give blood for more than 4 hours. So that nurse is going to need an in-service. You never infuse blood for more than 4 hours, because what happens is when you're giving that blood for more than 4 hours, you're increasing the risk for that patient to get a reaction. Okay, so we keep it under 4 hours, never more than 4 hours. What room assignment by the charge nurse would be best for a 4-year-old with spinal muscle atrophy? A, private room. B, semi-private room near the nurse's station. C, rooming with a 4-year-old admitted 4 days ago with rotavirus. Or D, rooming with a child with cystic fibrosis receiving IV antibiotics. And the correct answer is B, semi-private room near the nurse's station. Why? Let's go through these choices. Well, let me tell you why first. So this child has muscle atrophy. You can't put them in a room with patients that have infections, right? So that gets rid of C and D. And then A, private room, the patient doesn't have an infection, all right? So A's wrong. You don't have to put them in a private room. They don't have an infection. C and D are wrong because those patients have infections and you don't want to give it to the patient. So the correct answer is B. You can put them in a semi-private room near the nurse's station. Oh, that was our last question. Okay, guys, like I said, there are going to be more priority questions to come. And the only reason I place so much emphasis on priorities because so many questions are really priority questions. And there's no way as a student you're going to know the entire textbook. You just can't do it. But if you have a good grasp on priority and delegation, guys, you'll still be able to figure out the right answer. Okay, so there are going to be more priority and delegation content to come. Guys, please, if you guys enjoyed this video, please don't forget to like and subscribe below, and just make sure you comment if you want to see any videos that I haven't covered already. Thanks for joining me, and I'll see you next time.